Hello, everyone. Welcome to HIMSS TV and CIO Spotlight. My name is Mike Milliard. I'm Executive Editor of Healthcare IT News, and I'm here today with Ash Goel, who is the Senior Vice President and Chief Information and Informatics Officer at Bronson Healthcare Group in Michigan. Welcome, Ash. Thanks for being here.
Thank you. It's a pleasure, Mike.
So we'll talk in a bit about what you've got cooking these days at Bronson Healthcare Group, but I wanted to talk first about an education session you're going to be doing at HIMSS22, which is coming up in March in Orlando. The title is Practicing Medicine in the Age of Private Equity, Venture Capital, and Public Markets. So what's the deal there? What are you going to be talking about?
Yeah, I am really looking forward to HIMSS22, and in particular, excited about this session that I'm co-hosting with a colleague from the private equity funded healthcare side from Oak Street Health, Dave Buchanan, who is the Chief Clinical Officer for Oak Street Health. For me, it is going to be very interesting to understand and gauge the reaction from the audience, because we are having this as a fireside chat to discuss the pros and cons of the evolving business models of healthcare. Mm-hmm. All my life, I have worked in nonprofit healthcare, traditional integrated health system delivery models. The last so many years have been about changes in how the physicians and clinicians have felt the pressure and the burden of adapting to change, whether it is in terms of the technology that is used in healthcare, or it is in terms of the practice models that are evolving with continued evolution of growth of larger and larger health systems, and the regulatory changes that are happening all the time in healthcare.
So how do you view the terms of that debate? I mean, there's clearly some benefits, there's clearly some challenges as this continue to evolve. What are some of the hot button issues you think will be discussed there?
I think the one very obvious hot button topic would be that private equity is always looking to be driven by the bottom line.
Right.
And does that bottom line mean that it is more work and less attention to detail, or less attention to the consumer or the patient and the level of clinical care that people get? And my position on that is, well, the answer is yet to be told, but I believe that healthcare is ripe for disrupting the current models, because if we can get closer to service delivery models that are funded through lack of capital constraints, adapting to and adopting technology better, faster, we will have better outcomes. Ultimately, 5 years ago, talking about patients as customers was considered a bad word in healthcare. Right? Mm-hmm. I think as we start thinking about it differently and really start to treat the patients and their families as our customers, then we will feel that we have removed barriers between the delivery of care that is being given to the patients and who we as existing healthcare providers answer to.
What are some keys to taking advantage, I suppose, of some of these innovations without, and avoiding some of the downsides? Are most providers culturally prepared for some of the changes that some of this would entail?
Yeah, I think providers are certainly going to be looking at it two different ways. Mm-hmm. One is about, as you mentioned, change, and change is never perceived to be good or never perceived to be of a positive nature till it comes. 10 years ago, EMRs were considered such a challenge. At least I can speak to my healthcare institution and several others that I work with. Now, I don't think there is a provider or a physician out there that will say, take away the EMRs and my life will be better. Mm-hmm. Not to say that they haven't created their own challenges and their own problems. Okay? I think how we do this and how we come at it is as important, because it's about giving agency and giving power to the people and making that connection between the physician practicing the medicine and the patient receiving the care. When you think of putting those two together and solving that problem. We believe that the right answer is right in front of us, which is to remove barriers between that patient and that provider to get them both the tools that are needed to do their job well. There will be about 25% of providers who will jump at this because they're burnt out right now. They want something different. You know? The 50% in the middle pack will probably go, well, there comes another idea. And do I really care for it? Another 25%, like always, will want to say, no, just take me back to the other time when I was there.
Any perspective or lessons learned from your own point of view about at Bronson as far as PE and VC investments go?
We have tried to pivot ourselves again into that philosophy of being customer focused and customer centered from a very traditional healthcare delivery organization to leveraging digital technologies to focus on our patients. And the culture for the medical group, which is about 700 physician strong, has been very much about delivering good care and quality care. And we've been at the forefront of whether it was adoption of patient portals or use of technological devices to support patient transparency or sharing of information. I can very proudly say that 70+% of our million odd patients are active users of our patient portals.
That's great.
Just because of the value that both the patients see and the providers see. You know, whether it is release of information or it is scheduling of appointments or it is about interacting with the care team. It's been about that. And I think that has been the reason. It wasn't anything that I did as an IT leader. It was all that the operational leadership and the clinical leadership did.
So what else have you got going on there? What are some of the projects you'll be working on as we go further into 2022, either tactical or strategic?
Yeah, I'll speak to a more strategic view into some things that are going on. One of the constraints that we have faced this year has been around the amount of proliferation of tools and devices and systems that people have to use to interact with each other. So this sort of whole suite of applications that is out there that not only do we support, but also it detracts from mechanism of delivery of information to people. Do I look at my email? Do I look at my text? Do I look at the message in my EMR? Do I wait for a phone call? Do I look at that little badge that I have as an ER nurse, like those call badges that people carry?
Sure.
And we are working on a unification of all those individual pieces of equipment. It's about this proliferation of different things that we're trying to integrate into a single footprint of solutions that we're looking to drive for collaboration for our teams.
What, besides your education session, what else is on your to-do list in Orlando? What are you hoping to learn at HIMSS? What will you be looking for in the show floor? What do you got going on there?
Yeah, I'm really looking forward to the second day of the conference. Not that I'm not looking forward to every other day. I think the first day will be very exciting because of the breadth of the multi-faceted viewpoints the different keynote speakers will bring. Learning from other industries is very important, and that strategic thought leadership that they bring is wonderful. The most exciting sessions are the second day around Accelerate Health sessions, because I feel that's at the bleeding edge of where things are going to go. And I want to hear from all the people that are presenting, not only because it is a great thing to hear from those people, but also to open my own horizons to what is possible, and then turn around and say to the people who are out there selling dreams, maybe in some way. And I think those are very much the right things to think about. I was reading about the journey of some disruptors from before. Classic example of somebody like that is Steve Jobs, quoted all the time. Right? When Apple as an entity was formed, World Wide Web did not exist. Right?
That's right.
We became who we are not because we settled for what is comfortable. We became who we are by building on the shoulders and the energies and dreams of people who challenge the norm, which is why I think that session day is the most important one for me.
And we should note that your session is part of Accelerate Health as well at HIMSS, correct?
Yes.
All right. Well, looking forward to it. I appreciate you taking the time to talk with us here today, and I hope to run into you in Orlando.